Welcome back, everybody. Thank you very much for coming back quite so promptly. Hope nobody burned their mouth in their coffee. So we've got a pretty crisp hour coming up. A crisp hour of presentations and as much discussion as we can fit in before lunch. At 1 o'clock, and I hope not to go over. So we've got 4 presentations. One of them is being beamed in because the guy from Bristol isn't making the journey, but it's the only person who's able to speak who's not in the room, which is quite a revolution nowadays. So we have 4 speakers. I'm going to ask Lorraine, who definitely needs no introduction this time, to start us off, and then we'll canter through the programme as it's published to you. Okay.
Okay, so in the same vein as what I did earlier, I was really just keen to give a bit of an overview of where we are, just to set the scene for the speakers, the second group of speakers, and we've got a really great lineup covering potential interventions. So I'm really just going to very quickly go over why we chose the themes of this session, how that links to Obesity Action Scotland's work, the Scottish Government's work, and whereabouts we are in the journey of implementation. And I don't expect to cover that in enough depth, so we can talk about that later at questions if there's other things that people want to ask about. So this is just an important message to really frame this session, and it's a quote from the CEO of the World Obesity Federation at the very recent World Obesity Day 2023. And here she's just reflecting really on the high-level failures that mean we don't have the environmental, healthcare, food and support systems that we need to live happy lives. So it's under that kind of thought that we are moving into this next session. And just very quickly, I wanted to recap on Obesity Action Scotland's 3 asks, our 3 priorities for action since we came in, since our inception in 2015. Have been the same, and they will continue really to be the same until we've reached a point where we're quite satisfied that they're implemented effectively. So these are population level public health policies that we're looking for, and we focus on promotions, advertising and the out-of-home environment. And we like to think it is no accident that those 3 actions also feature in the delivery plan. We spent a lot of time in the very first years of our existence working hard with the civil servants and the politicians to make sure that those 3 areas were a focus when the 2018 delivery plan came out. So in terms of the key actions around environment, and there are a lot of actions within that Healthier Future 2018 plan, but the 3 about the environment cover promotions, advertising and out-of-home sector. And I think that's why we really felt those were 3 key themes to update on in this session, and to provide a bit of the thinking around the new evidence that has emerged in these areas, and where we are with policy, and what we know around the challenges that we face here as well. So we're going to cover those 3 issues with our next speakers. So very quickly, where are we in terms of policy with promotions? The programme for government, it was expected that we would get a bill before COVID. We had it featured in the programme for government for 2019 into 2020. It was delayed by COVID. It reappeared in the programme for government for this year. So we are still anticipating a bill to be laid this parliamentary year, so before June. There was a recent consultation, which we're still waiting for the publication of. And we've also seen some work move forward in England on this around location promotions being implemented recently in October 2022. A delay on the implementation of the price promotion restrictions in England, but that's anticipated to be introduced later this year. And there's a lot of advocacy work going on to make sure that that still goes ahead. In terms of advertising policy, levers are quite varied. It's obviously a real mix of reserved and devolved powers. And we've seen, obviously, the kind of disappointment from the UK side, where we had the Act, the Health and Social Care Act, went through and legislated for a 9 PM watershed and restrictions on online advertising, and aimed at reducing children's exposure, but the implementation date for that was pushed back and has been originally to January 2024, but has now been pushed back to October 25. The government saying that's about giving the industry time to comply with it, but by the time they're introduced, they're going to have had 4 years to prepare for what's fairly simple legislation. So we're still, and the Scottish Government are still of the position where they support the UK Government to do that, and would like to see the UK Government push ahead with that. And we can talk in more depth later around the actual areas that are devolved, but we've seen kind of indications of areas of devolved powers through the recent alcohol advertising restriction, consultation, and what's proposed in there. And so there are things that could happen around local advertising policies, outdoor advertising, billboards, things like that. And then the third area that we're going to hear more about today is the out-of-home sector. We've got the Scottish Government published an out-of-home action plan, and that includes a range of actions, everything from potential mandatory calorie labelling, which we've had a consultation on, all the way through to more voluntary measures around children's menus, and an eating out, eating well framework that the Minister referred to. There's still a lot of work going on in that area, and we'll hear more about that, but we'd like to see a kind of comprehensive approach to that. And I suppose our position at Obesity Action Scotland is we would like a lot more of what's in that plan to be mandatory rather than voluntary. We're concerned that the voluntary measures might not then become to implementation. So I don't have a lot of time. That was a really quick rattle through the policy areas. We are going to hear much more in depth about some of the evidence and some other interventions that have happened. So it'll give us a lot of things to think about, and we can go back to policy if we need to in the question and answer session. Thank you. I just hope that was useful to set the context. Thank you.
Thanks, Lorraine. So Lorraine's been busy with the government and various others, including trying to shout at the English, or the people south of the border, to see if we can gee them along. It's pretty thankless work, frankly, at the moment. Anyway, let's go to a very interesting area that I don't know enough about, which is about the food system, the food chain. And Professor César Reverendo-Guijar has come from Scotland's Rural College to talk to us about that. Professor Guijar is an applied economist working in the area of agricultural and food economics. His PhD is in agricultural and resource economics from California. And his work covers the analysis of the whole agri-food supply chain. That's agriculture, processing, distribution, retailing and consumption. The operation of all of that together within the environment that we experience as consumers. So look forward very much to what you've got to say. Thank you.
I have 2 minutes. Many thanks for the introduction. And many thanks for being here and being able to present this in person. This is the result of a project and was worked together with colleagues from the University of Aberdeen, Professor McNamee, who's over there, Faisal Akaichi from SRUC, and Patricia Norgood from the University of Aberdeen. The outline, what I'm going to present is this background. Since we're talking about food, you would like to see the ingredients, so it's important to speak about the data, then cooking methods, I mean, the methodology, and of course, the output of the food. And we had basically intercategory results that came from the intercategory models, unintended consequences that was, since you're putting a policy, you want to know what else could have happened, and the intracategory results, and I'll explain what they are, and some conclusions. So, as I mentioned, this came from a project that ran 2019-2020. And of course, our lives were interrupted by COVID, so this went much longer than expected, actually, and probably this is the first time that we're having a presentation on this. Something that is very important is what the measure was, what we were asked to evaluate, because it's not well understood. I mean, first, it's an ex-ante evaluation, because the measure didn't go. I mean, it was postponed. Then, the idea was to restrict the advertising of promotions, not of promotions. And I'm going to explain what it means. Then, well, to estimate the intended consequences of the policy of this restricting the advertising of the promotions. And then the other important thing is that the focus was households, not individuals. I mean, we are not analyzing, and it was household purchases, not consumption. I want to highlight these kind of differences because it's important in order to understand. And we didn't evaluate health consequences. That's something that the Scottish Government was going to do with our results later. What do I mean by the advertising of promotions? And here I pick things that are not discretionary foods. I mean, nobody's going to restrict peri-peri sauces or things like that. Basically, the idea was to remove those tags that advertise the promotion. This doesn't mean that the price cannot go down, but you wouldn't know that, I mean, unless of course you buy every day, so you know that the price is lower. But so, prices would move freely, but no more red tags or yellow tags or whatever the supermarkets are using for advertising the promotion. In terms of discretionary food products, I mean, you know, it's all those that are high in fat, sugar, and salt, high in calories, low in nutritional value. And the discretionary foods, which were taken from the Food Standard Scotland, were take-home confectionery, biscuit, take-home savories, cake, pastries, trial fats and sugar morning goods, total puddings, and desserts, take-home drinks, edible ices, and ice cream. Okay, that's tasty enough. In terms of the data that we use Kantar panel data set, which from 2013 to 2018. And we just pick households that were observed at least 40 weeks out of the 52 weeks that were possible, which give a total of 9,914 households. Kantar presents information about purchases for consumption at home, and I mean, it's very detailed information because in contrast with other data sets, you have information at the level of the product. I mean, the product that you see in a supermarket. And you have nutritional information, you have the type of promotion that was advertised. I should say that basically what we concentrate here was all the promotions. But if you just want to see the the promotions that the latest consultation is focusing on, we did also the analysis, and it's in the web page of the project, so you can find that information. Then we had the information broken down by quintiles of a Scottish index of multiple deprivation. Imagine that you have a data set with each one of these households, and you classify the households according to different dimensions. And the dimensions were the Scottish index of multiple deprivation, the rural-urban classification from the Scottish government, which is 6 groups, the household income ranges that comes from Kantar, and life stage groups, pre-family, young family, middle family. So basically, we estimated the different models that I'm going to show, considering all these classifications. So as you may imagine, the amount of work done is huge. I'm not going to present all the tables because we would have all day long to do that, but you can find it in the web page. We have all the information at a very, very detailed level. In terms of methodology, what we did was 2 methodologies. Demand models, which comprise intercategory model, the assessment of unintended consequences using the intercategory model. And then we also had, the intercategory model and the choice experiment. I'm not going to speak here on the choice experiment because it was relatively small in comparison with the other one. We are currently doing a much larger work with a much larger sample. In terms of methodology, I mean, the only thing that you need to know here is, first, it's not as complicated as it looks. We estimated that demand model, and so you have here basically the share on the expenditure for different groups, and we divided this into 3 effects. The price effect, which would include the promotion, I mean, as I said, the income effect, and then the promotion presence effect, whether the promotion is there. Because remember, what we want to do is to remove that red tag or yellow tag, depending on the supermarket. Once you remove that tag, which in the model is basically to set up that variable for the discretionary foods equal to 0, you will get new distribution of shares. Since we are not changing incomes or prices, you can deduce the amounts, the changes in quantities, and from the changes in quantities goes straight, because we have nutritional information. So you get the nutritional information, so you have the changes in nutrition. Okay. This. Okay, let's go to results. This is probably the heading, if I had to choose something on the. This comes from the intercategory demand results and considers all the samples. Since I'm going to be using basically this similar scheme, this bar, I'm looking at it orange, but used to be red, is basically, here you have the change in energy, sugar, fat, saturates, and sodium. And this one is basically the change in calories due to the measure. Note that this is basically when you apply this only to the discretionary products. this is due to the unintended consequences, which is basically the substitution when you do the measure, and this is the net effect. So you have a net effect of 613 kilocalories down, due to the policy of then, well, basically due to the nature of the products, the most important decreases are on sugar. I mean, you have that. It's followed by fats, and salts tend to be much smaller, and in some cases you have the opposite direction. According to this, I'm not going to be able to finish. So, since you're going to have access to the slides, the structure of the tables is exactly the same. You have the change in share, the change in expenditure, the change in quantity for each one of the discretionary categories. And after that is deduced the change in energy, protein, carbohydrate, and you have in the red column the total for the discretionary categories, the other foods and drinks, which is the unintended consequences, and the final total is the net effect. I should mention there's a paper that is referenced in the presentation at the end, and we computed standard deviations and all the other things, if you want to be keen on the statistical part. In terms of, let me go to the next one, which is the life stage, given the topic of the seminar. Although for all the groups we saw reductions in calories, sugar, and saturates. Sodium was more variable, but in most of the cases you had a decrease, and you have a decrease for young families and middle families, and these are per capita per week information. In terms of the substitution, you increase by 297.8 the energy. So there's substitution towards the products that are not being part of the policy. Something very interesting is that, well, if it's to believe the results, it will increase the consumption of fruits and vegetables, because that's the increases that you're going to find on sugar, and again you have the detailed changes in the report. After that, there's quite a number of tables, which I'm going to skip, but the structure is exactly the same, and you see for all the intra-categories, and the difference between inter and intra-categories. In an inter-category, you can substitute things from, say, the discretionary foods towards fruits and vegetables and things like that. In intra-category models, you do the substitutions within within the category. As you'll see on all these results, all of them indicate similar. I mean, they are not exactly the same as the intercategory, but all of them indicate the same qualitative results, which is decreasing energy, decreasing sugar, and decreasing in saturates due to the policy. So let me go straight to the conclusions, because I'm already in deficit, and I'm an economist, which is a shame. So due to the policy, we have a net reduction in 613 kilocalories, and that's approximately sort of 4.5 to 5 of a daily diet of 1,939, which is from the time at the time from family food. As I said, the results are very consistent for all the groups and categories, and they show a decrease in energy, in sugar and fat. There's unintended consequences, but even then, I mean, you get a net result which is the expected one. I'm sorry. And yeah, basically those are the main results. I mean, probably I should have liked something that we discussed at the end of the project. I mean, it's not a silver bullet because you will need quite a number of measures, but it seems to be on the right track. And I just wanted to highlight that we didn't consider health implications of the policy, which I suppose, as far as I remember, the Scottish Government was going to do that analysis, that follow-up. So, thanks very much.
Thank you very much indeed. It may not be a silver bullet, but it looks quite promising. Anyway, I'm very relieved you skipped past these rather intimidating equations. I haven't seen anything quite like that for a while. So, but thank you very much for that. Can we move on to the next presentation, which is going to beam in from Bristol. This is a recorded presentation from Barry Norris, and he will be available, we think, towards the end for questions live. So that's the way it's intended. Barry's an external communications manager at Bristol City Council. He's had a varied career with Lambeth, with the Wildfire and Wetland Trust, with the National Institute of Adult Continuing Education in Leicester, the London HIV Prevention Programme. He's been involved in the communications for Bristol City Council that surrounded the pulling down of the Colston statue, which you'll be aware of. I think that I like this most in his bio, partly bearing in mind what I was going through over the weekend. In his spare time, he used to enjoy reading and socialising with other adults. He now mainly reads and socialises with his 15-month-old son. So, but he's more interesting than that. So bring on Barry Norris if you can. Thanks.
Hello, I'm Barry Norris. I'm an external communications manager here at Bristol City Council. I'm sorry I can't be with you today, but I'm going to talk you through, hopefully, as quickly as I can, a bit of an overview of Bristol City Council's own policy and our approach to healthy people and places. So, Bristol's a tale of two cities. It's quite a hilly place. Up on the hill, near where the suspension bridge is, you tend to have wealthier areas, and then in the surrounding kind of north, south and east areas of the city, you have more areas of deprivation, and with those areas of deprivation, as I'm sure you folks know, there tends to be more food insecurity, and there's some stats there on the screen that give you the details of that. This is what it looks like. In terms of, if you look at those green areas, that's the Clifton areas and the more wealthy areas of Bristol, and surrounded, as I said, the darker red colours are areas of deprivation, and you've got life expectancy there as well. And just to bring this one stat out, 15% of Bristolians live in the most deprived 10% of England's areas. So even though sometimes Bristol, it's a southern English city, has a reputation as a fairly wealthy place to be, that certainly applies for some people, but by no means all. So what makes us healthy, and how can local authorities help? Well, there's many different ways that we can intervene, and as a comms professional, I'm very interested in the aptest moment to intervene to try and make a difference in terms of behaviour change campaigning. Our kind of approach tries to tackle different elements of the things on the screen here, looking at different moments when you can influence what people choose to eat. And our goals as part of our approach to healthy eating are also listed out here. Again, I'll just pick out one or two. We obviously want to reduce inequalities, but specifically we want to reduce levels of overweight and obesity across the city. And we also want to kind of try and improve resilience and sustainability in the food system in Bristol. So how did we go about doing it? Well, one of the first things we did was the Bristol One City approach in 2020. The Mayor, Marvin Rees there, made a very clear statement about finding ways to talk to different partners, perhaps the most overlooked people in the city and the overlooked partners in the city, so not the usual suspects that get involved in decision making politically. So he set up this One City process, which involved almost an alternative way of trying to, basically through a sequence of meetings with people that would normally be left out of various conversations in terms of power and decision making. And through that One City process, we adopted several kind of strategies for food safety. And there's a list of them there, but it involved things like eating better awards, also creating targets about giving access to affordable fresh food within 10-minute walk from their home, and our longer term goals, which are still on there, which we're still aiming for now, to do with schools, behaviour change in schools, trying to encourage them to grow food for their own use, and also focusing on sustainable council-owned land as much as possible. Quite close after that, soon after that, as part of our One City Plan process, Bristol became a Gold Sustainable Food City in 2021, and we also created our Bristol Eating Better Awards at about the same time. So that's, we give awards to businesses, to schools, and also ideas providers to try and promote kind of and reward food businesses that are doing things that we think are really great. Following on from those developments then, we moved into kind of regularity approach. What can we do in terms of the law to point people in the right direction? And that's where we got to our advertising and sponsorship policy. What does it cover? It covers all communications, including photos on our social media, photos in our publications, any kind of communication we might have. It also involves any materials to do with partnerships. Most councils have a massive array of partners, includes sponsors, contractors, etc. Tries to cover all of those, so the policy applies to all of those. And also any advertising space owned by the council or sponsorship agreement. This one is key, and it's the one that we deal with most in the comms team, and that anybody that implements an ad policy probably will deal with most. When I used to work in London for London's HIV campaign, we obviously had a massive portfolio in terms of the TfL Transport for London suite on the metro, also on buses, just all of those tube stations, and we had a massive amount of advertising space that we can influence. It's slightly different in Bristol, slightly smaller. We tend to have just bus stops and some other odd advertisements here and there. So that's going to be key. If you want to implement this policy, think about the advertising space you have access to, and the amount of influence you'll be able to have with that will obviously follow. A definition of our policy, wherever we receive money and the advertiser gains publicity, or the other way around, wherever the council pays money and which group the council gains publicity. So advertising and sponsorship are the two things that the policy specifically deals with. And this is the bit that refers most to obesity. So 5.3 of our advertising policy. Content that is not permitted for advertising and sponsorship includes, but is not limited to, advertising that contains, implies or suggests availability of alcoholic drinks, promotion of a food or drink brand, and the key one, promotion or availability of food and drinks that are high in fat, salt and or sugar. And the way that we measure that is through the Department of Health and Social Care's nutrient profiling model. So how did we implement the advertising policy in Bristol? My team, worked very closely with the public health team, so I'd advise anybody that was to implement it to engage in some way communications experts to help them with it. We led on the implementation, we policed the content, and we're kind of the main gatekeepers for the advertising policy. Step 2, I'd advise make it easy for colleagues. We kind of adapted a lot of materials in terms of lunchtime learning sessions, in terms of presentations, really bespoke materials for our contracting team so that we could translate what the nutrient profiling model says into plain English as much as possible and make sure the organisation understands what we want it to do. I'd also recommend as step 3, build in support from local councillors or local politicians as early as you possibly can and establish who will arbitrate on and decide borderline decisions. So the way we did that in Bristol is through talking to each of the different political parties. Use the nutrient profiling model, but as I said, make it bespoke. Also provide support to calorie information conversion websites. We created our own PowerPoint that helped people to understand that they need to use kilojoules in their measurements, and they also need to only use 100 grams of a substance when they're working out the sums for the nutrient profiling model. So there's some tricky things there that if you're not that much of a statistical or a mathematical person, you're going to struggle to do unless people can talk you through it. So bespoke the materials as much as possible. This is an example from our intranet here where we talk about high fat, salt, sugar foods, and we're almost hinting or giving ideas for people about what's okay and what's not in terms of advertising. And so there's a big list there that we provide for internal audiences so that they can understand, roughly speaking, what's okay and what's not in terms of the nutrient profiling model. So I've got a few examples here. I'm going to whiz through them. And I just want you to take a moment just to think about whether you think 100 grams of one of these products would be okay under the advertising policy at Bristol or not. Obviously, we're using the nutrient profiling model. So have a quick think about it. This is the first one, a croissant. Yes or no? Do you think under a nutrient profiling model, this would be deemed healthy or unhealthy? Next. An egg and cheese McMuffin by a very famous fast food provider that I probably don't need to name here. Do you think that would be okay or not? Healthy or not healthy, according to the nutrient profiling model? I've only got 5 examples, so this is the third. Iron Brew Extra is a Scottish example I know. I switched now to a national brand for one that I'm very fond of myself. Do you think this is something that would be deemed healthy or unhealthy under the nutrient profiling model? Iron Brew Extra. Another famous fast food chain here, Katsu Waddler. Do you think that would be healthy or deemed slightly unhealthy? And finally, a pie. Not just any pie, this is a pie, an example here. It looks kind of like a veggie pie, and it doesn't have too much pastry on it, so okay or not? So just to whiz through those, according to the nutrient profiling model and our scores that we've given to 100 grams of these products, the croissant would not be acceptable. A McMuffin from McDonald's probably would be okay. It's mostly egg, mostly protein, so it balances up. Iron Brew Extra doesn't have sugar, doesn't have fat, it doesn't have caffeine either, so probably that's going to be okay. We don't have a line about caffeine in our profiling model, but in our ad policy. But that may be something for the future. We might see that we bring in something like that outlaws caffeine in drinks, but for the moment, Iron Brew Extra should be fine. The Whopper is a definite no, and a pie is probably a maybe, depending on the pastry content and depending on what's actually in the pie. We found through experience that probably some are okay and some aren't. So these are all actually examples of things that we've talked about with internal members of staff here about what's okay and what's not as part of our ad policy. But I thought it'd be useful for you guys to see in practice the kind of conversations that we end up having about food and drink. And like I say, the delineation here is croissant mostly unhealthy probably, and Whopper mostly unhealthy, so it's unlikely to be something that we'd advertise across our portfolio of sites. And the other 3 examples there are probably something that would be okay. So that's my presentation, that's the ad policy. just trying to give you a little bit of a taste. I'm hoping to be with you for questions and answers after these presentations, and looking forward to seeing and talking to some of you later on. Thank you very much. Hello, I'm Barry Norris. I'm an external communications manager here at Bristol City Council. I'm sorry I can't be with you today.
Gosh, so good they said it twice, just like New York. Anyway, that was fascinating. Brings back memories of trying to negotiate with Breaks Brothers for Breaks Brothers for their chicken pie, and I failed. Anyway, but without further ado, I'd like to go to the last presentation, which is with Gillian Purden from Food Standards Scotland. It's about the out-of-home food environment, and this has come up previously in our discussions. Now, Dr. Purden leads the Food Standards Scotland Science and Nutrition policy branch, and manages the nutrition programme in the FSS. Worked for the FSA, which is the predecessor organisation, for a while. Her academic career included 6 years of postdoctoral work focused on energy metabolism and diabetes research. But she now leads a team to publish a robust national picture of trends in diet and nutrition and disseminate the science and evidence base to influence policy development to improve diet in Scotland. So who better to tell us at the end of the morning how we're getting on and what needs to happen next? Julian.
As if by magic. Oh, there we go. Thanks very much for the introduction and the invitation to speak today. And as Andrew's outlined, I'm going to give a little bit of a context to the out-of-home food environment to sort of explain a little bit of the data that also was highlighted by the Minister earlier as well. So hopefully this will help to bring a bit of colour to some of the discussions that we've already heard today. Now, I think this is the pointer. Okay, so first of all, basics. What do we mean by the out-of-home sector? Because this is something I'll shorthand all the time, but it's just to make it clear to what that means. So it means any food and drink that you buy when you're out of home. So on the go, you might buy a coffee, sandwich, that type of thing, but it also includes things that might be delivered home. So a takeaway that it's delivered to your home or something you pick up. Now, we've published quite a lot of publications on this, and if you can click the link when these slides are circulated, and you can see some of our data. But some headline statistics here. There's over 40,000 outlets in Scotland, and it's a huge and diverse sector. So we're talking everything from a coffee shop and a bakery right through to a sit-down meal. It's quite a big value to Scotland as well. The out-of-home sector values around 3.6 billion back in 2021. But it might surprise you to know that the average spend per trip is actually quite low. It's around just over £5. So just to then sort of move on from that a little bit more and to sort of expand on why that might be, can tell you a little bit more about our out-of-home behaviours. Now, they have been impacted by the pandemic. Obviously, the out-of-home food sector was significantly impacted and had to close. And a lot of those organisations or outlets pivoted to delivery services. So pre-pandemic, we were visiting maybe up to 4 times a week, and now it's more like 3 times a week. Now, as I said, the average spend is actually quite low. So what we're talking about really with these visits is it's low-value visits at coffee and cake. It's to these quick service restaurants, convenience parts of the supermarket, rather than the full service meal, which are only really accounting for about 7% of all our visits. And also, the other point to make here is that those in the lower social classes will visit these types of establishments more frequently. And I think that talks to some of the inequalities information that we've heard earlier today. So why are we interested and how do we have a focus on the out-of-home food environment? Well, we do know that around a quarter of our calories come from out of home, and that eating out of home is associated with obesity. We know that the average calorie contents of things that we'll buy out of home are higher than the similar equivalents in the supermarket. So if you buy a muffin from a coffee shop, it's likely to have a lot more calories than a muffin from Tesco, for example. Also, the out-of-home food portions are bigger. They're typically a lot bigger than the things we'd eat at home and are often higher, and their foods are typically higher in fat, salt and sugar. So what types of foods are they? And I'll move on to that next. Now, we've talked a lot about discretionary foods, so I don't need to explain to you what they are, but things that we don't need as part of a healthy diet, basically. So we're talking things like biscuits, cakes, pastry, confectionery, crisps, savoury snacks, and these are really above the main commonly purchased things when we're purchasing food out of home. Now, you'll may be interested to see there's no meals really there if you exclude sandwiches, but there is chips. So chips are purchased more frequently than a main meal when we're out of home. And I'll just now show you some data that we collected from, in Scotland, big branded businesses. So this was data collected in 2021, I think. But really, it's to highlight the range of calories that can come from different food categories out of home. So you can have a huge range in a main meal, averaging 800, which is high, but the lowest could be less than 200, but highest over 5,000. So 5,000 calories from one meal, which is twice the recommendation for an average meal, and that doesn't include any drinks or anything else that might be consumed during the day. So these sort of things are of huge concern to us. But I suppose it's also useful to say that that doesn't include all, some of them are lower calories, so there are some businesses doing really good things and producing nutritious and lower calorie offerings. So we know it can be done, but the average is too high. So one of the other things that we've seen since the pandemic is an increase in takeaway and delivery. A lot of businesses switched to using that mechanism to increase their trade, and that seems to be a trend that's continuing to increase. So since pre-pandemic, 2019, we've seen about a 35% increase in delivery, home delivery, and that's an increase of 122 million trips, so it's pretty significant. And we're very aware that delivery apps that are very accessible to particularly the younger population are something that are increasing, and it's something we want to keep an eye on and look at in a bit more detail in some future work that we're going to carry out. So this slide just shows some work that Scottish Government did last year and published towards the end of last year, looking at promotions out of home. So what is encouraging us to buy food when we are out of home? And this was done using a mystery shopper, so somebody who went in and the establishment wasn't aware of them. And they looked for the promotions both in-store and online. To summarise the results, the promotions were found to encourage people to eat more than they intended to, and they really are skewed towards the less healthy foods. Consumers also noted that they weren't often or always able to make an informed choice. The nutrition information just wasn't there. You'll see that there's a difference between online and in-premise, with more promotions in the in-premise, but there's not much data in the online part there, and that is, as I say, something that we want to gather a bit more data about. So what does this mean for children? I suppose that we're talking a lot about children and obesity and trying to reduce obesity levels in children. So I just want to touch on some data around the diet of children in Scotland and then how that relates to out of home. So as the Minister mentioned, we do have some information from the Scottish Health Survey that looks quite promising in some respects, in that the portions of fruit and veg look like they have come up slightly within children. However, we don't really have a comprehensive data set. We only have frequency of some things like fruit and veg and discretionary items, which we know are consumed very high, with a high frequency in children. So to address this gap, we are going to be conducting a survey later this year of children and young people aged 2 to 15, and one of the researchers from the University of Edinburgh is in the room. Can't see you, but so that will be happening later this year, and we're looking to get a sample of about 1,700 children. So this will really help to give us a lot more in-depth information about what children are currently eating. What we do know is that there are children's menus within restaurants. You'll have seen them when you're out, and they typically tend to be skewed towards less healthy offerings. Our data shows actually that children, when they eat out with adults, they tend to eat less healthy food when they're out with adults. The types of menus you see, they're often marketed to under 12s, and we did some analysis of these types of menus a couple of years ago, to look at the types of offerings that were currently in the marketplace. So this is, again, for bigger branded businesses. And meal deals commonly include things like a drink and a dessert. Vegetables aren't always provided as standard, and sometimes kids have to choose between chips or vegetables. In terms of desserts, you've got ice cream sundaes and brownies, things like that are very popular. And some of the foods actually have quite high calorie values, which can be a little bit concerning. Menu items, it's probably no surprise, the frequent things are things like pizza, burger, chips, and often sugary drinks. But more recently to this, we have done some research with independent, so smaller businesses, in terms of what their practices are around children's menus, to try and get a bit of an insight into any opportunities there, and potentially how we can maybe move forward developing a code of practice. So this just shows some of the findings. So in terms of some of these menus, it's pretty disappointing really that only around 60% are providing fruit or vegetables as standard. And in terms of the insights from the establishments, there's kind of a lack of responsibility. It's not their problem, that's for the parents. They should be telling the kids what to eat and making sure, and they're only trying to provide things that people are actually going to buy. I mean, they're looking out for their business. I've got a couple of other quotes here in terms of, that treat culture. Again, it's, we're going out for a treat, don't interfere with that. And again, people don't want to sit and eat healthy things. They just want something that's convenient, tasty, and fast. And that's the focus. So you can see that it's a difficult challenge to try to change some of these mindsets and the provision that's on offer. So coming on to solutions, and what can we do then to try and improve this out-of-home environment, food environment that we're interacting with. So as the Minister and Lorraine mentioned, we're developing an Eating Out, Eating Well framework. So this is in partnership with Public Health Scotland, and we're leading on a part to look at children's menus and develop a children's menus code of practice. Now, the Eating Out, Eating Well framework will be tested with different groups in the public and the private sector alongside the children's menus code of practice. And that pilot will happen later this year. However, so it's going to take a wee while before that's implemented, and it is a voluntary framework, so it's worth making that distinction. We had recommended to Scottish Government for their out-of-home action plan that should be mandatory measures, but it is more difficult to get some of those things into the sort of policy, push forward in policy, but we will still continue to recommend that. However, in the meantime, what we do have on our website is a series of healthier catering guides for businesses, and there is one specific for children's menus. So that's something, and we do have them also in different languages as well. So just to give you a flavour of the types of draft commitments or principles that we're testing as part of the Children's Menus Code of Practice. We've got them up on the screen there. We've had conversations with businesses, and overall they've been pretty warmly received. But if people have some feedback, if you'd like to give me any of your insights, I'd be very happy to receive them. Okay, so I'll just conclude then. So I think we do know it's pretty convincing really that the out-of-home food environment does have a significant impact on our overall diet. Eating out is no longer that occasional treat. It's something we do all the time, and it's those small, frequent purchases that we really interact with and most regularly. We see that the foods and drinks are really skewed towards the less healthy items, and they're also promoted. So it's very, very tempting. It's very difficult for consumers to go against that. Children's diets are also influenced. If they're having these children's menus from a young age, that's just the sorts of things they're expecting as they become older. But the good news is there is scope for improvement. The businesses we've spoke to have been receptive, and there are principles that we can try to embed going forward. However, and I think the Minister highlighted this morning, it is a tough time for business. We appreciate that, and we understand that to get businesses on board, it will be a challenge, but it is something that we're going to be taking forward. And I just wanted to finish actually with a little plug for a resource that's on our website. It's called Eat Well Your Way. It's designed at the consumer level, but it does have information when you're eating out with children or eating out on your own, how you can actually do that more healthily if you want to. But there's also other tips for shopping and planning and things like that. So yeah, have a look at that if of interest. But that's all from me. Thanks.
Many thanks, Gillian. I'm conscious that all the speakers pretty well kept time, yet time is running out. So could you please, the three speakers, come up to join us? We may be joined by Barry Norris, maybe not. Can we have 2 questions, quite brief questions, and even briefer answers, and then we'll wrap up proceedings for the morning. Who's first? In fact, we'll take the 2 questions together if we've got them. Anybody got anything? Right. Hello there, Barry. Thank you very much for joining us, and thank you for your contribution. I mean, one thing, if nobody's got... oh, you have, yes. Shona. But Bristol's a very sparky place. A lot of common features with cities that we know well. So, you know, we should learn from the deep south of England, because there's quite a lot going on there. Shona.
Hi, Shona Hilton from Glasgow Uni. So we've heard quite a lot today about different initiatives, and we've also sort of heard the Minister speaking earlier, you know, about there being, to some extent, a real difficulty, a real challenge just now in terms of actually getting this onto the political agenda because of multiple reasons. And one of the things that I'm just wondering is, you know, we've talked about moving things from voluntary to actually moving things to mandatory. And Andrew, you asked earlier, what do we do as an army? Well, what do we do to move things from voluntary to mandatory? That's for everyone.
Right. In fact, Anna's here too.
Well, I think from my perspective is provide government with the evidence to support what you want to change. And that's where we kind of come into it. But I think if you've got robust evidence that says you need to make these changes and the evidence base shows that this will have this benefit to health or whatever your outcome is, that is the best way. Because really, and it was touched on earlier, that a lot of if anything that's legislative will be scrutinised to the very nth degree. So there has to be the evidence to support that change. So that's where I would come in. I think that would be the key.
Yeah, and I think to add to that, it absolutely is about that, and I think we have to do that issue by issue. And I think the kind of the benefit of doing it issue by issue is that we can also show where the experience has told us that the voluntary approach didn't work. So we had the agreements and the process at UK level a few years ago where there was a voluntary approach to things like promotions, and it was very clear and agreed round the table that that's not going to be possible because there's a commercial element to that and only a mandatory approach will work. So it's about being very clear issue to issue on where it needs to be mandatory, how the evidence shows us that a mandatory approach will help with that.
Barry, any comments on voluntary to mandatory?
Yeah, I was just going to add basically in terms of measurement that's really important, and it really helps with the politician side and convincing them also. So we have an evaluation that the University of Bristol are helping us with, which did its first wave of surveys last year, and we're just in the middle of a second wave at the moment. So that's I showed that little map of Bristol at the start there. So those surveys go out to the most deprived audiences in the city, and we're asking them essentially whether they've seen a difference in terms of advertising, how that's impacted what they're eating, where they're eating. So those kind of questions that Dr. Patton talked about in her conversation as well. So yeah, definitely evaluation and measurement is everything in terms of behaviour change, and that will definitely help you.
Thanks very much, Barry. Anything from you, Cesar?
I mean, experience shows that it's amazingly difficult to basically to do things mandatory. I see it in other areas like contracting and things like that. Probably, I mean, as was mentioned, I think the voluntary approach is a first step, and it's important to sort of, how to say, encourage and advertise those that are doing it right. I mean, but I mean, it's very heterogeneous in terms of the responses. I mean,
Yeah.
that's
Okay.
you see it on both sides.
Okay. One more comment from Anna, please, because could we have the microphone down to Anna, and I think that will conclude.
Sorry, mine was a question actually, if you want to move
Okay.
on.
No, it's just I thought you might have quite a lot to say about this question. Go for it. Have a question and some very quick answers.
I really enjoyed the presentations, thank you very much. I have a question which was to Barry about the work you've done in Bristol. And I'm interested in the political economy around what you've done. So how easy was it to make it all happen? Have your councillors been lobbied by food industry to try and not make it happen? Has there been much resistance? If so, from where? It's obviously a nice example which other local authorities could follow, and it obviously builds off the GLA's work, which is great. So congratulations on doing it. I'm just interested to learn a bit more. Thank you.
Barry.
Yeah, great question. Thank you. In terms of the political economy, it probably speaks a little bit about the nature of Bristol. That politically, the politicians were kind of driving it a little bit, particularly as you'd imagine from the Green side. Bristol's quite mixed in politics, so at the moment there's about 24, 25 councillors from Labour and from the Greens, and then also some, I think it's 12 from the Conservatives, 5 from Lib Dem. So again, that's quite a broad mix and unusual in English politics, certainly. So many of the Green councillors were driving it, but it has to be said the Labour councillors also were driving this. So very early on at the start of the process, we took it through the scrutiny panel of the council, various committees. It went through everything. So before we'd even kind of started, we had built up a lot of political will already, and because the politicians were driving it to some extent or wanted to see changes, that also helped us. There were also a couple of pressure groups in the city, and there's an organisation called AdBlock, and Sustain is another one that were really pushing hard for somewhere to do this, and obviously Bristol decided to take a dive first and give it a go. The one thing to add on that made it difficult and slightly less easy is that the most things we were criticised for in the press when we went live with this was about it didn't go far enough. You know, that's what Bristol's like. They were wanting us to ban things like fossil fuel providers, airlines and stop ads from those kind of places as well. So it wasn't that people were complaining about the food options that they were given. It was that we really weren't going far enough and further in terms of trying to do that. And just one quick final point on that. The reason we didn't go further yet is because there's not a nutrient profiling model. There's not an easy way to measure, like there is with high fat, salt and sugar foods, like there already is. You can easily measure what's okay and what's not using that model. You can't do that with fossil fuels and with various other things that we try and restrict as well. So you have to almost create a blacklist or a whitelist to be able to do something like fossil fuels or tackle that. And that's obviously setting up legal precedents that probably Bristol wasn't prepared to go to just yet. So, yeah, hope that answers your question.
Thanks, Barry, very much indeed. Well, time is against us. I think we're going to have to seal it up there, but it's fascinating that they have a very different environment in which they work. We're not going far enough. Wow. When does that happen here? So anyway, thank you very, very much to all of you for this morning. Thank you particularly to the speakers who are here on the screen and in the front of the audience. It was absolutely terrific what we were hearing. You will shortly be getting some feedback requests, probably by email after this event, just to see what you thought of it. So rather than putting your hands up now, that'll be coming by electronic means. I've been asked to say a few short things, but time is very short indeed. What I would say is that everyone's been very polite about where we're heading here. We're heading either wobbling around or we're heading in the wrong direction. And we need to stop things going the wrong way and start things going very much the right way in order to achieve our ambition. So there's quite a lot to do here. I'll respond to the Minister's challenges to be bold. So within within the levers at our disposal, and we can't, cure the Ukrainian war and cure inflation, but we can do things within our own area, and we should do them together, collaboratively. As Cesar was saying earlier, there is no silver bullet, but amongst the array of weapons we have at our disposal, we could be a very effective mass of people, an army of helpers, as the Minister was looking for. These might include quick wins. We've heard about promotions. We've heard about holding feet to the fire with the Food Foundation. We've heard about advertising. We've heard about an entire sector where we're trying to do things. So there are areas where we could act, many areas indeed. Our role, as Julian just said, is to inform, to advocate, to challenge, then to monitor. Maybe worthy and dull tasks, but they're absolutely essential in order to move us from where we are to where we want to be. Every level matters, whole population, targeted, government, community, everything matters. And we are part of that army of people who will make a change. We can't just look to the Minister within the limited powers she has. There's things we can do too. So thank you so much for this morning. Thank you for to the Obesity Action people who have been terrific in putting this together, and the college too, the greatly skilled people all around the place. Many, many thanks indeed. There is a lunch. Reminds us that food's not just a nutritional issue, it's a social issue too. So enjoy lunch, which I'm sure will be excellent because it usually is here, always is here. And I hope to see you again at an event similar to this. But meantime, let's go on to try and achieve this ambition. Goodbye.
It's a long time no see. Yes.
No, it's really...
So much more we can do as well. There's so many other things to come. But I don't know.
Yeah. That is...
I know.
Good. Good.
Well, start some other discussion. Good. Excellent.
Wow. Good.